Let's bring in Dr. Ashish Jha. He's Dean of the Brown University School of Public Health in Providence. Dr. Jha, good to see you.
Thank you.
This is the first case, and to me, it's really concerning. It's a young man in his 20s. He has no travel history, no contact history. He's in isolation right now. Does that to you indicate how virulent and contagious this new strain may be?
Yeah, so thanks for having me on. It does. It says that we know this strain really does look like it's about 50 to 70% more contagious. It also says to me that this is in the community because he didn't get it by going to the UK. He got it from somebody in Colorado, and therefore it's spreading in Colorado, and it stands to reason it's spreading in other parts of the country as well.
How fast do you think it will spread? Remember back to the nursing home in just outside of Seattle when we first heard the first cases here in the U.S., and look what happened since then.
Yeah. So the short answer, Eric, is we don't know. And this is why we need to be doing surveillance, right? We need to be sequencing these viruses. This is what the reason the UK discovered this so quickly is because they sequence a large chunk of the viruses that they identify. We have not been doing that. So we got to get going on that. We've got plenty of capacity. We got to figure out how widespread this is and then make decisions after that.
How concerned are you about this? I mean, it's in Europe. It first started in the United Kingdom, then they saw it in South Africa, and now it's in France, Switzerland, throughout Europe, as well as in the Middle East, in the UAE, and I'm concerned about Canada. You know, Doc, if it's in Canada, you know, it's going to get here.
Well, it's here. It's in Colorado. And I suspect if it's in Colorado and somebody who didn't travel, then it's probably not just in Colorado. So we do have to get on top of this. I'm concerned because 50% more contagious means more people getting infected, more people getting hospitalized. And our hospitals, as you know, in many, many places, quite stretched. So we do really have to get on top of this thing.
And well, the vaccines, we're told that they can blunt this one, just like the first strain. Is that true?
We don't know for sure, but everything we know about these vaccines makes me feel pretty confident that the ones that we have right now will work against this variant. I'm not super worried about that, at least not in the short run.
Meanwhile, we have this tragedy down in Louisiana. Congressman-elect just elected, 41 years old, Luke Letlow, out there campaigning, and well, like a week and a half ago, he's diagnosed with COVID-19 and he passed away, leaving his wife, Julia, and two young children. It is so heartbreaking and shows that this virus is deadly. It's a killer and it spares no one. Your thoughts on the fact that a congressman-elect who was supposed to take the oath of office this Sunday, in the prime of his life, is cut down by coronavirus?
It's heartbreaking. And again, for the family, I just can't even quite imagine what they're going through right now. So it's awful. It is a reminder. There are a lot of people who like to say, well, it's only elderly people who get really sick. It clearly does affect elderly people more often. But the bottom line is it affects all of us. And anybody can get very sick from this. This is why it's important that we really keep the level of infections low, because this story, this case is a real example of how things can go badly.
And, you know, what really strikes me about the late congressman-elect that's so heartbreaking, especially, is if you look at it, the photos on Twitter and this sort of thing, there are a lot of campaign rallies, a lot of personal small events in Louisiana, in that district, in the central part of the state. And they're not wearing masks. He's standing around with supporters who are not wearing masks. Your thoughts for our audience right now as a reminder of what they really should be doing?
Yeah, look, this stuff should not be political. It shouldn't be partisan. We know masks work. They're a way to protect yourself and others, especially right now, given how much infection there is. Everybody should be wearing a mask when they're outside of their home. That's just the right thing to do. And the fact that we've somehow made this partisan or political just bothers me. It's a public health measure, and we know it works, and people should follow it for themselves, their family, their community.
Dr. Jha, well said. Our heart and sympathy and our prayers go out to the congressman-elect's family. It is a tragedy and a sad reminder of the deadliness of this disease. Dr. Jha, thank you.